So let's shift gears and talk about the way that physical activity and exercise impact cancer risk. And so, despite the number of people that get cancer, this is a very challenging question to answer because of, the long-term data that really need to be collected. But in general, what exercise does is it improves or reduces the gastrointestinal transit time. So food and substances move through the colon much quicker in people who exercise. So that's less time for foods to come in contact with the colon wall to cause damage. It also reduces baseline insulin levels. We talked about that with diabetes and hyperinsulinemia. It also reduces inflammatory factors. So breast cancer, the data are not quite as strong, but overall some data indicate that it's more your lifetime PA, your physical activity over your lifetime and maybe even your physical activity in your teen years. Once again, reduces insulin and insulin-like growth factor, and also reduces body fat. So body fat tends to store estrogen, and obviously estrogen is going to promote hormone-dependent cancers such as breast and female reproductive cancers. And men can also have estrogen too in their fat, so that is a factor. Endometrial cancer, similar mechanisms to breast cancer, lowers the estrogen, the stored estrogen, lowers body fat, and may have a relationship with body weight. Lung cancer, this is very tricky. There is a lower risk reduction with being physically active, but it's difficult to control the effects of smoking and exposure to secondhand smoke. Prostate cancer, the data are a little less consistent, although more recently the data have indicated that, there was some studies that showed that men who had high physical activity had more prostate cancer, but further follow-up data showed that it is due to better medical care, that men of higher socioeconomic status get screened more often. And of course, survivorship with exercise, that high physical activity post-cancer may be related to survival, but these data are kind of preliminary. And for women with breast cancer, especially those that have hormone-sensitive tumors, that there's a better relationship with physical activity. Let's see. I've got the same thing there. Never mind. Okay, we will move on. The ACSM Cancer Roundtable. This was a panel of experts that got together in June 2009 to discuss role of cancer in exercise. A lot of physicians are very reluctant to have their patients exercise. As we've talked, they may not always receive the best training in exercise and behavior medicine. So we'll talk about this in class and what were some of the major recommendations that came out of the Cancer Roundtable. So be sure that you have your article with you. And so if you look at the, pre-testing, so looking at people who want to begin an exercise program, take a look at this chart. We'll cover more exercise testing and programming in the next class, but these are what, all the things that people should, the considerations for people with different types of cancers before they even begin an exercise program. Potential signs of recurrence. Unfortunately, this can happen. Many cancers do tend to recur. If you are working with cancer survivors, as they told us in the webinar, there is going to be a small a percentage of people who are going to get recurrences and who may pass away. So you have to be prepared as a staff to be able to deal with that. So, unfortunately, that is just something that happens. So, we as the exercise specialists, we can, if somebody mentions symptoms to us or we notice things, it's important for us to discuss this with part of the client's team. Most of the time these people are going to have physician permission and talk to a nurse or somebody, another type of professional, that about these types of symptoms. Have they had any changes at their cancer site? Have there been changes in any of their blood values? Have they lost weight unintentionally? You know, that's a big sign. Are they losing their appetite? Are they, you know, incredibly fatigued? Are they complaining about bone pain or headaches? Because that could mean that that tumor's cancer has maybe spread to their bone or to their brain. Are there changes in their bowel or urinary habits? So there could be cancers, you know, recurrences or metastases to these areas. So very important to keep in mind. So let's go through the summary here. Cancer is likely to overtake heart disease as the #1 killer as we have an aging population. And talking with some of the Westminster residents, some of them have had cancer 3 times. So people can survive cancer multiple times. Know the most common cancers. Know which is the most common cause of death. Be able to explain the role of diet and exercise in cancer prevention. Be able to understand the roles of surgery, chemo, and radiation, side effects, both acute, short-term, and longer times, and know a little bit about the role of exercise in cancer prevention.